Hey, Dr. Josh Bletzinger here, coming from Rosary High School. I'm here with Lauren, who is the athletic trainer here at Rosary High School, and Mary Lou Kunold, who is the longtime athletic director. And today I get to do the interviewing instead of the talking. And I have questions as we're working here to follow up on our concussion investigations. So, being in a high school setting, there are in Illinois laws and policies that are in place now, and through this investigation, we just want to get an idea of what is going on and how they're approaching the management of concussions with student athletes. So I just have a few questions here, and feel free to answer these. The first one here is, what's the protocol or protocols you use for student athletes to assess concussions?
Well, the IHSA, the Illinois High School Association, really has set guidelines for every school in the state that we mandate follow. When our kids come out for a sport online, they have to sign forms and releases that they have read the materials connected to about the IHSA concussions, a knowledge of it, and then also our factors of how we deal with the concussions. Our trainer basically has the full say concerning concussions, and we make sure at our parent meetings that they understand that it's the trainer's call when an official stops the game and says to assess. And then Lauren would do her pieces with the athlete and lets us, the coaching staff, and the officials, if she deems no, the person can return into a game, or no, she's done for the day. I know she'll probably be able to tell you more about the specifics that they cover. I know there's a memorization. We're definitely looking at the eyes. Can they recall what day? Do they know where they're at? There's all kinds of things on that line.
And so what's the recommendations at that point? Let's say somebody does have, or you screen them and suspect a concussion, what are the guidelines at that point?
Well, the screening piece, as soon as the trainer would tell us the athlete is finished for today, we get a hold of the parent, hopefully they've been at the game, at the event, and we start to say, okay, our athlete is now in shutdown mode. And we'll give them paperwork that this is the signs of things that you want to go home and monitor for tonight. You know, how coherent they are. Are they having problems just with speech patterns, or are they real sensitive to lights? We also try to make sure that they get shut down from multimedia. And that is the biggest point. And then even in our parent conferences, that I always stress, you sprain your ankle, what do? You rest it. You know, your arm's hurting, what are we going to do? We're going to rest it. Well, you just sprained your brain, so we're going to rest it. And that means you are totally doing no phones, no texting, I don't care. You get a pass for homework for tonight. You know, you have to just go home and let that settle down, and let's see.
Got it.
The next day, and in part of their evaluation, they have their concussion checklist
symptom chart. So I'll sit down with the athlete, go through a list of symptoms. It's numbered 0 through 5, 5 being the worst, 0 being no symptoms whatsoever. And each day we'll sit down and we'll go through the symptom chart, and then see how they're progressing on a day-to-day basis.
Good.
So yeah, the symptoms are very important, you know, and hopefully we're being honest, and then we'll follow up with the parents too. What are you experiencing?
That's great. That leads into the next question, is what's the in-school management of a student athlete as they heal from a concussion? So now we've suspected it, you have the management protocol at that point. What are some scenarios that happen as far as the school management?
Well, it all comes back to what Lauren just said on this test. If they come in and they're getting good numbers, then she'll take them out. Okay, let's put you on a bike. If there's no symptoms showing, then we start a return to play protocol, and basically taking them just through elevate the heart rate, get some exercise. What happens? Are they stable? Are they, you know, how functionally sound are they looking that way? Well, we can get them on a bike, we can put them on a treadmill, she can just, doing lines on the floor, can they balance? We've got all kinds of different balance objects here for them to do. Then from that point, they'll progress into their sport skills, and then taking it, again, a little bit more advanced accelerations. Are any of the things we're doing throwing symptoms back? So she'll go back and do some testings again, and hopefully they aren't catching on to what we're doing. But, you know, because to just say, oh, no, I'm fine. Well, it also is some of the balanced ones, it just throws it right away. We can tell what's going on.
Yeah. So that's great. I mean, you're demonstrating here that the management protocol can happen within the school underneath your license and your authority and your management. So
Right.
that's great. Did you have something to add to
Yeah,
that?
kind of. If we get the really severe concussed person, and then we will recommend seeing a physician. And we've had some good that it really worked with sport medicine, the athletes on concussions.
Yeah.
When that happens, they've also, they take the impact test.
Okay.
Besides her set of that she'll do, once they're symptom free, we put them back and take an impact. All athletes coming into the program as a freshman have to take the impact test, so we have a baseline, and then junior year we redo them again. So that'll be the first that she'll be also looking to see where our records are and how they're looking.
Yeah.
The athlete cannot return to play until we get a clearing from Lauren,
Mm-hmm.
or even if the physician says, hey, yeah, we're okay, they still have to come and do our planned program of working back into practices, partial, full, and then we would allow game intervention. Sometimes it depends. Sometimes it can be a 5-day turnaround, and it's good. And we've had a kid who was 8 months.
Yeah.
Yeah.
So that's a good point on the athlete side. So we know that these students are, you know, professional athletes, so they do have to be here for school. So
Which
my
brings
last question
to
for you is:
rusting the brain.
are there other school staff members that get involved in concussion protocols and or the management? How is this relayed to the academic side of the school, and how does that play out with the student?
And it is a combination: return to play, return to the classroom. So as soon as we find a student is concussed and showing higher symptoms, Lauren will contact the counselors, and then the counselors contact athletes, all their teachers, and let them know we have the student athlete now who is down with a concussion. So depending on the symptoms, we will they go to sometimes half days. One day come in the morning, the other day in the afternoon. They may even just go to the counselor's office and do 2 periods or a period and see how it's going, and monitoring them that way through the counselors will, and finding out how they're doing. The teachers are aware, obviously, that we may not be seeing really good memorization going on, that their test scores aren't doing well, and they will keep that into consideration when the athletes' grades are being produced too.
Yeah.
Which is very important. And I'm very fortunate that we have this strong, cohesive going on between the Sparks. And we always emphasize again to the parents and the athletes, this is a medically excused time for you. You do not have to be doing. And we're so academic structured here. And when that occurs, when it's going into semesters, they're sitting down and taking the most grueling test. And we're like, no, you're not going to do good on it, so what are you doing? You can take this up and take them back in the summer. It doesn't matter. They'll get time. We need to have them just recoup and get to where they can.
So what's the one best piece of advice you could give, or probably a lot of advice, but what's the one thing that parents should take away from this environment or what you were talking about and their student?
I think a combination of be upfront about the symptoms they are observing. Don't hesitate about saying, hey, this is what my daughter's like. All of a sudden, man, she's just really aggressive. Well, side effect of a concussion can happen. The lights in our classrooms, you have to wear sunglasses, go for it. But you have to communicate back and forth with us, and also be able to understand. You will see you could see some results academically that, hey, she's not that student she was right now. It's got to take some time to rehab, and it'll come back.
Great. Do you have anything to add here, Lauren?
Yeah,
to
I mean,
finish
just
up?
as far as behavioral, I like to make sure I spend time in getting to know the girls. So if any, concussion does occur, I kind of know what they're normally like compared to what their symptoms are showing. So, if I have girls who are coming in, they're always upbeat and outgoing, and then all of a sudden, they're kind of soft-spoken and kind of, a little outcast from where they usually are. It's easier for me to pick up on, if they're faking it, if they're trying to push their way to, getting back to return to play a little bit quicker. So just kind of getting to know the girls a little bit more to aid them through their progression with their concussion.
Great. Well, there you have it. You have a very in-depth and thorough management system from a high school setting and in an institution that takes academics very, very seriously. So just like concussions are very serious. They're on the rise. No sport is immune to it. Yeah.
We have gone from a golf to swimmers and not a divers, to swimmers who's head to head one day doing lanes.
Yeah.
Basketball, you name it, we have had the concussions and
Good.
Just some freak ones, but
Yeah. Well, there you have it, and we'll have more for you on concussions here in other videos, and we will talk to you soon.
all good.